My name is Stefano Sinicropi. I'm an orthopedic spine surgeon. I currently practice in the Twin Cities. My background training is both in orthopedic surgery and neurosurgery through fellowship. I've currently been in practice for about 10 years, and during that time period have performed approximately 5,000 spinal surgeries, including cervical and lumbar conditions, and including minimally invasive surgeries, as well as total disc replacements, both of the cervical and the lumbar spine. So I think that the most important thing about what we do in dealing with conditions of the spine is really needing to focus in on what the actual problem is. And I know that sounds a little bit strange because it seems like it's an obvious issue. The spinal canal is very, very complex, and there's multiple joints. So there's joints, there's discs. There's a lot of different things that can cause back pain, leg pain, neck pain, and arm pain. And so I think that at the heart of my treatment philosophy is you don't touch a patient with a surgical intervention unless you are certain to a high degree of certainty what their primary pain generator is. And so, for the lay people, you don't fix something unless you're fixing the broken part of it. And so many different parts of the spine can be creating pain. And so the first thing we have to do is get the right diagnosis. And I can't tell you how many patients come to our office who have been quote unquote worked up for spinal pain, except they don't actually have a diagnosis. They just know that they've got bad discs or they've got a bad spine or something, but we don't really know where their pain's coming from. So it's the philosophy of measuring twice and cutting once. I cannot stress enough that when you do surgery, you want to try to do the absolute right surgery, and that includes doing the appropriate amount of levels, not doing too much, but it's also as bad for a patient not doing too little. So if a patient's traveling for their procedure or taking off the time for their procedure, if you only do 50% of the work that needs to be done, guess what? There's 50% more that needs to be done, and that means more time off from work, more traveling, more pain, more recovery. And so I think that in a nutshell, my philosophy is that the right diagnosis leads to the correct treatment. So as I was saying before, I think that because of how many patients I've seen through the years and the gaining of experience through seeing so many thousands of patients, I think that allows us to have developed a specific treatment algorithm to try to get to the right diagnosis so we can make the right treatment decision, especially when it comes to the act of doing surgery on a patient. So it's very, very important to have that. As far as my practice and how it's evolved over the years, I think what differentiates me from a lot of surgeons is just the sheer volume of surgeries that I've done now, having done about 5,000 surgeries in a 10-year time frame. And I was lucky enough to go to a place where there was a lot of patients available and build a very large practice. And then on top of that, I think once you start becoming very experienced at treating certain types of conditions, then you start to really work on more minimally invasive techniques encompassing a much wider range of injuries and diseases. So in other words, if you're only tackling the easier problems early in your career, once you get to that 4,000th or 5,000 surgery, then you're starting to be able to do very complicated cases through very minimally invasive approaches. And so I think my practice has progressed to the point where we're pretty far ahead of where a lot of our other surgeons are in town. And then I would say another thing would be the use of disc replacement technology and really having expanded the indications for motion preserving surgeries such as disc replacement.